And can you all hear me? Okay.
Yes.
Okay, all right, thank you. So good morning and welcome. We are at the LivHOME Home Care Hangout for May, and I want to first thank our panelists today for taking time out of their busy schedules. The topic of our Home Care Hangout for this month is Alzheimer's disease. We're going to cover diagnosis, treatment, and management of Alzheimer's disease. My name is Marilyn Berman. I'm an elder care consultant with LivHOME. And LivHOME is a national caregiving and geriatric care management company. We provide in-home care, and we work with a lot of families who are experiencing difficulty with their loved ones and caring for them when they have Alzheimer's disease. I'm going to start with a statistic that's a little bit alarming. We now currently have an estimated 5.2 million Americans of all ages who have Alzheimer's disease as of 2014. We're looking at that increasing in 2050 by as many as 7 million people, ages 65 and older. So today we have panelists. I'm going to go through them one by one and have them introduce themselves. So we will start off with Dr. Eric Landy, who is a PhD and neuropsychologist. Eric?
Hi, I'm Dr. Eric Landy. I'm a neuropsychologist, which means I'm a specialist in doing assessment of thinking skills, and particularly thinking skills that can be affected by dementia, such as memory loss or language difficulties. I have a practice in Oxnard and also Santa Barbara counties, and I also teach at UC Santa Barbara.
Thank you. We're so fortunate to have you with us. Thank you, Dr. Landy. And next, Luciana Kramer, who is a care specialist with the Alzheimer's Association of the Central Coast in California. Luciana? Luciana, are you there? Maybe we might come back to her. I don't know if I lost her. Maybe her interest, something happened with the... There she is. Hi, Luciana. So...
I'm sorry, I was going to unmute myself and click the wrong button.
It's okay.
But, thank you for having me. I'm Luciana Kramer from the Alzheimer's Association. I am with the California Central Chapter in Santa Barbara, California, and I do provide direct support and resources to families dealing with Alzheimer's disease.
Thank you. Thank you for joining us today. And next we have Denise Brown, who is the president and owner of caregiving.com. Denise?
Hi, Marilyn. Thanks so much for having me today. I'm thrilled to be with you guys. My website helps family caregivers. It's really the voice of family caregivers, so family caregivers share their days through blogs, online support groups, and chats. We have chats twice a day for family caregivers, so it's a way to connect with others in a similar situation. It's a way to break up sometimes the monotony and the grind of caregiving, and it's a way to vent about what the day is really like for a family caregiver without worrying about being judged, because we're always empathetic. We provide an empathetic listening ear.
Oh, wonderful. Thank you. That is so needed. Thank you so much. We also will have today with us Stan Israel of Long-Term Care Insurance Specialists. He'll be sharing with us the cost of Alzheimer's disease on families and their loved ones and ways to work with paying for it. But Stan is going to be joining us in just a little bit, so let's get going. I wanted just to start discussing, first let's, Dr. Landy. As a neuropsychologist, because I know the term isn't known by a lot of people. People are starting to learn more about neuropsychology, but as a neuropsychologist, what is your role in the diagnosis of Alzheimer's disease?
In general, our role is to assist the physician in determining the diagnosis and also the actual effects of the condition on a person's thinking skills. For example, many people have memory difficulties for various causes, sometimes just related to normal aging. We do testing to try and look at what patterns of difficulties are they having, because certain patterns are predictive of certain conditions, such as Alzheimer's disease. But more importantly, we actually look at not just what is the disease, but how is it affecting the person. Our goal is really to try and help keep the person as independent as possible So we try to determine what are their particular weaknesses and what support they might need to really make them more effective in their normal life.
That's very important. That's really, really important. And how closely do you work with the medical doctors or geriatric doctors with your diagnostic process?
Generally very closely. Usually a patient's actually referred to us as part of the initial workup. So if someone comes in for an evaluation of possible Alzheimer's disease, the doctor usually will initially do something such as do blood work to see if the person has any vitamin deficiencies or things of that nature. Then they might send someone to get a brain scan to see if there's any structural problems. So for example, a CT or an MRI. And then we are at the other side of the coin where they'll send someone just to see what is the person's functional skills like. So they'll do tests of memory, attention, concentration, language skills, all those types of things.
Wonderful. Now I know that there's a lot of misconception. Many people still feel that Alzheimer's is all memory loss. But what other forms of dementia do you see, and from what diseases are they coming from?
Well, actually, there's many different types of dementia, probably anywhere from 50 to 100 different types. For Alzheimer's, actually, the primary characteristics are memory loss, particular difficulty forming new memories, and also language skills. So generally, with Alzheimer's, we're looking for those two problems because that's the area of the brain that's first affected. But other conditions that could cause it could be including things such as cerebrovascular disease. You know, we all understand that people have strokes, which sometimes affect brain functioning, but sometimes even smaller problems like diabetes or high blood pressure can actually affect thinking skills in the brain because it damages the blood vessels in the brain and damages the surrounding regions. We can see problems such as that, conditions such as Parkinson's disease, and even things that are a little more rare like mad cow disease.
Oh my. Okay, thank you. Thank you. Can we go to Luciana for a moment? Luciana, what is exactly your role at the Alzheimer's Association?
The Alzheimer's Association has 3 primary goals. One is to fund research, one is to promote advocacy, and the third one is to provide direct services and support to families affected with Alzheimer's, but not only Alzheimer's, all forms of dementia. And my role within this scope is the direct support. So I am the person that a family would come to find information and direct support groups, and direct education as well. We have 75 chapters around the country, and my role is in the Santa Barbara chapter, the Central Coast California chapter. But a person in other parts of the country can call the 800 number and they get linked directly to the closest office. And a person just like myself would be answering the phone and assisting them with information and what to do. Because when somebody gets diagnosed with Alzheimer's, it's not on the radar for most people to get prepared when we are all healthy and living our lives, to get prepared for Alzheimer's disease or any form of dementia. So they go through a shock, and they really need that a person to talk to them and help them through that very difficult process. And that's what I do.
They're very fortunate to have you. I can imagine. You speak to many people a month. Do you get a lot of calls every month?
I get a lot of calls every day. There's a sort of an epidemic in dementia as we all getting older, and families really. Our goal would be to reach a family at the very earliest stage. So fresh out of a diagnostic from Dr. Lundy, for example, we would assist them at the beginning. And when we don't connect with that family at the beginning, we would be just waiting for a crisis to happen. And some people call us in a crisis mode for the first time. Those are the most difficult to help because we haven't worked with them to prepare them to avoid a crisis to begin with. Yes. So it's a variety of situations.
Yeah. Okay, thank you. Thank you so much. I'd like to go to Denise. Denise, what is your role at caregiving.com, and what is the purpose of your website? What is your mission with your website?
So I think one of the greatest challenges when you're caring for a family member is to feel engaged in a community. The experience of caregiving can be very isolating, and it's isolating for a few reasons. It can be because it's difficult to find respite care, so you can get out to, for instance, a support group in the community, or stay engaged in the activities that you've always enjoyed. When you're caring for someone, your time shifts from time that you had for your activities, your life, into caring for someone. The other reason that you're often isolated is because it can be difficult to find someone who understands what the experience is like for you.
Yes.
So you worry about talking honestly about what it feels like, because you often will encounter even someone in the family that might not really be able to respond appropriately, or even just take the time to listen. So when you come to caregiving.com, there's a community that understands, that you don't have to explain why you're having a difficult day. You can just say, I'm having a difficult day, and I really just hate my life. And everybody will say, oh my gosh, I felt like that yesterday. It's not a, oh, you shouldn't, oh, you'll feel better tomorrow. It's just, let's meet you right where you are in this moment and see what we can do to help you feel better.
Wonderful. So you have created literally a peer-based support system online. And is that international? I would imagine you cover the entire world at this point.
Yeah. We are international. We've had bloggers from across the pond, so to speak, which is always exciting because there's a cultural element that they blog about, which is always so interesting to us. So if you feel like you're landlocked because of caregiving, when there's a blogger from another area who blogs about what their life is like, you feel like that's an escape as well. I launched the site in 1996, and at the time, everyone thought I was just nuts. Why would you launch a website to help people who are caring for a family member? But to me, it was this captive audience, simply because you are often housebound, and the internet is the way that you escape. So I hope when people come to caregiving.com, not only do they feel understood, but they also feel like they're taking a little bit of a break, too.
Right. Thank you. Thank you for what you've created. It's a gift to all families and family caregivers. Thank you. I believe I see Stan. Is that Stan? Is he on?
It is.
Hi, Stan. Good morning.
Sorry, I was late.
I would love for you to have a moment to introduce yourself and tell us a little about your business and what you do.
Okay. Thank you. Thank you for having me. My agency was established almost 20 years ago with the express purpose of explaining what long-term care and what long-term care is. I know Denise said something about how Alzheimer's and dementia are very isolating. What most people don't realize is the wear and tear on the informal or the unpaid caregiver, such as a spouse or a child. What long-term care does, or long-term care insurance does, is it allows somebody to shift the responsibility to somebody else, so that a caregiver or a informal caregiver could take a break. And statistics showed us that 56% of the people who are caregivers actually die before the person that they're giving care to.
Right. Right. It's quite an alarming statistic. When I started working in senior care about 17 years ago, I would rarely get a call from a family that had long-term care insurance. And now I would say upwards of 10% or a little bit more of the calls that I get, the families have it in place, and it makes such a huge difference in their lives and the stress on them. It really is very necessary that we look into that. I want to go back to Dr. Landy and just, if we could, I know that there are, this isn't a question we have planned, but, you know, in the diagnostic procedure, determining whether a patient has Alzheimer's or something else, the question comes up, what is the CT, the difference between an MRI and a CT scan, and are they necessary? If you were to walk a family through a diagnostic process that you feel is the one that they would get the best results from and really clear outcome to determine what treatment should be, what would that look like?
The general diagnostic process would be the family would initially meet with their primary care doctor and express some concerns. Some doctors are much more comfortable looking into conditions such as dementia than others, just based on their experience, especially, for example, if someone is a geriatrician. But in general, as I mentioned earlier, they're going to do a basic workup with doing things like test blood work and looking at other simple things to see if there's any reversible causes. Sometimes you can have something simple like a vitamin deficiency like vitamin B12. Lots of people get injections for that, and they don't realize that a lot of that is because if you don't have those injections, you could have memory problems. But if there still are concerns, then generally the doctor would refer someone to a neurologist, and the neurologist would usually start by asking for a brain scan, like a CT scan, to look at the structure of the brain, to see if there's any evidence of, for example, a small stroke, or maybe even a brain tumor or something like that, to see if there's a problem directly in the actually brain tissue that might explain what's going on. And usually the other side that they do then is they also send someone for testing. The type of testing I do looks at functional abilities. So we'd be doing tests of memory skills, language skills, and reasoning skills, and a number of other things. And generally, for example, my type of assessment takes about 2 to 3 hours. So not quite as quick as the CT scan, but both are important because the doctor's going to take all this information and try to put it together. He's also going to look at the history and see, is this something that came on suddenly or something that came on gradually, for example? Using all that information, then the doctor can help determine what the diagnosis is. So really, it's a key of looking at the history of the person, doing basic medical work to see if there's something going on, looking at the actual brain as best we can, either through CT scans, MRIs, or sometimes even PET scans, and then doing actual testing of functional abilities. And really the goal there is to see how are you actually presenting as far as your memory. For example, with Alzheimer's, the type of memory loss we see is people usually forget new information. They just can't hold on to information over time. So you might tell them something or they might say something, and 5 minutes later it's gone. In comparison, if I see someone with, for example, depression, often they also have memory difficulties, but with depression, it's not that you're forgetting information, it's more just harder to learn new information and then harder to pull it out later, but it is there. So we try to really look at the patterns of performance that indicate what is the actual underlying condition. But in general, I would say for most people getting this type of assessment, it's going to be a matter of probably a month or so to go through the different medical portions and also the assessments. And then usually they have a fairly good idea about what's happening at that time.
Thank you so much. I know that, sometimes what happens to families and their loved ones is perhaps their internist may give a diagnosis of Alzheimer's, but they don't make it to the neurologist, or they don't make it to the neuropsychologist. Perhaps they don't get the scans, and that can really affect the outcome of the treatment and their life. So I'd like to go back to Luciana for a moment. And Luciana, what is the number one challenge that you see that faces the family caregivers caring for their loved ones with Alzheimer's?
Well, I've been working here at the Alzheimer's Association for over 4 years, and I've worked incredibly with over 1,000 families. So I see that there is across the board a difficulty for tailoring the gradual levels of professional assistance required to the actual needs of the patients. A family should be counting with geriatric managers, in-home care services, residential care, even hospice care at the end of life. But many times they are not assessing those services, and there are some barriers that I notice the reason why it happens. So a big one is lack of information about the disease. There is a lot of misunderstanding. Sometimes you mentioned that sometimes the doctors are not very good of referring to neurologists for further care. We have seen families who come here and say, no, she doesn't have dementia. The doctor says she has senile. And I'm like, what is senile? It's not a diagnosis. And we're talking about dementia with the changes in personality, in needs. Another big barrier is the financial barrier. All of these services cost money, and social services won't pay for them. And if a family hasn't been lucky and thought ahead to get long-term care insurance, which we would all want them to have, but in my practice it's just a minority. Less than 5% do have that. So they find themselves in really dire straits to help provide for this person. There's also the emotional needs. It's hard to cope with the changes in the person, the loss of your mother, the loss of relationship with your partner. There are family conflicts. Sometimes the two daughters do not agree what kind of care is needed for mom. We see a lot of that. And a lot of times the only caregiver lives out of town, out of state, sometimes out of country, which is so difficult to manage somebody who needs 24/7 care at some point.
Yes, absolutely. Thank you so much. I would like to go to Denise on that note and ask you, Denise, what is the number one challenge that you see, of course, again, facing the people that are on your site when they're reaching out and they're blogging? What are some of the obstacles that the family caregiver runs up against?
Well, I think it's kind of interesting. So I'll give you a general answer, which is I think it's getting through the day.
Yes.
But I think that specifically there are different reasons why the days become challenging. Sometimes it's challenging because you're just tired. Sometimes it's the grind. Sometimes it's that you're just completely out of ideas about how to manage the disease. One of my bloggers wrote this great blog post a few days ago. She cares for her mom. And the name of the blog post is All Aboard the Love Boat. And she writes about a day she had with her mom in that she did everything she could think of to keep her mom engaged in activities. They took walks. They watched a movie. She did everything she could think of, and yet her mom was still sad and still asking to go home. It can feel futile sometimes. Why am I doing this? Because nothing I'm doing is making a difference. It can be difficult to stay motivated because it can be so discouraging. I also think sometimes you have a difficult time separating the disease from the person. So one of my coaching clients cares for her husband who's in the early stage of the disease process, and she sometimes struggles to understand, is her husband forgetting because of the disease process or because of his selective hearing as a husband? Meaning that for years he kind of heard what she said as a wife, and she's always trying to figure out, is this our marriage dynamic or is this the disease process? And I also think that the disease process requires so much patience that you can often feel like, I just don't have enough patience for this. I think if Target could figure out a way to bottle patience and sell it, I think that family caregivers would be at Target as often as they could to buy a bottle, because you just feel like you can't get enough, and yet you can't recharge enough to get that patience back. So I think it's trying to figure out, how do I get day to day, and how do I make it for the long haul? One thing that I think is so helpful these days is that a diagnosis can happen early in the disease process, which means that family members have greater information, they have greater access to options and treatments and professionals like all of us, which is great. But then you think, the long haul, how am I going to make it for the long haul? This is a marathon that I'm facing. How do I stay in the best shape possible? How do I make sure that the budget lasts for the length of care? How do I protect my future as I'm caring for a family member, whether it be a parent or sibling or spouse? I think it's the worries that keep a family caregiver up at night, which can also make the day difficult as well. So I guess, so generally it's getting through the day, and then specifically it is a variety of reasons of why it makes the day difficult.
Thank you. And I believe we do need to have patients sold in bulk. That would be very helpful for many reasons, for all of us. Thank you, Denise. I would like to go back to Stan. Stan, that definitely the finances is like one of the things that we work with families. That's a large stress, is the financial, what it costs, what Alzheimer's disease costs a family, and how that plays itself out. Can planning ahead by obtaining long-term care insurance help a family avoid the financial devastation later on, and how does that work?
Yes, it could. My biggest issue, let me just clarify a point. I mentioned that it's 56% of caregivers die before the person that they're giving care to. Unfortunately, well, fortunately, it's less number than that. It's actually only about 36%. But when we talk about the wear and tear on a caregiver, they did a survey in Florida, and out of almost 200 murder-suicides, half of them were due to dementia. And it's the wear and tear and the financial. Financial takes care of some of the emotional and physical responsibilities of a caregiver. And unfortunately, as everybody has already said, the cost of care is expensive. It's going to increase even more because of the advances in modern medicine, whereas 30 years ago, 40 years ago, people who had heart attacks, they were told to remain in bed, not to exercise. Nowadays, they're up. Modern medicine, with all their medications, are extending our lifespan. And probably the doctor could probably tell us the numbers of percentage of people who are over the age of 85 that have dementia. They are living longer. Their bodies are in relatively good shape. And part of the problem that we have with long-term care insurance is the feeling, I don't need it now. I'll buy it later. And then it becomes too expensive, or they have something else come up, or they become uninsurable, which happens every single day.
Yes, yeah, exactly. Thank you. So when should an individual who is at risk of getting Alzheimer's disease begin to think about purchasing long-term care insurance?
The target age for long-term care should be between the ages of 50 and 65. And those are the pre-retirees. Generally, the kids are out of college and they're starting to plan for their retirement. Long-term care is one of the highest unplanned expenses that people are going to have. And it's cheaper then. Plus the fact that many of the insurance companies give discounts for those who are in very good health. And you're not going to be in any better health than you are today.
That's true.
May I ask a follow-up question to Stan?
Yes.
Thank you. Stan, I have questions from families who may have had the genetic testing, even though the results of genetic testings are still being understood by the research community. But if they found genetically there is an inclination for Alzheimer's, would that keep them from acquiring long-term care insurance?
At the present time, there is no look back into the genetic testing to see whether or not the person has predispositions to this. We're looking at that individual. It has been changing, though. A lot of things are happening in the industry because, for instance, years ago we used to have lifetime benefit. We no longer have that. There are people who've been on claim for so long they've gone through $1 million worth of benefit. And what happens is that the insurance companies look at their underwriting and they make the changes according to what their claims are. And eventually we might see that. Now one of the things that it's starting to do is do parameds, which is something that they didn't do even a year ago, unless you were over a certain age.
Thank you. Thank you. Back to Dr. Landy for just a moment, since we're talking about the cost of managing Alzheimer's disease and what how it taxes the caregiver and the family. How do medications play a role in assisting somebody with Alzheimer's and their loved ones in managing their care?
There's two primary ways medication play a role. One is that there are now medications to really prevent the condition from worsening, and these are medications like Aricept and Namenda. And really what those are is they're a little bit of a band-aid. They don't fix the problem, they don't make the person better, but they make a certain neurotransmitter be more available in the brain so that as you're losing neurons, even though you're losing neurons, your levels of that neurotransmitter stay the same because it's making more available. That's one of the types of medications, and the other medication is a little more, or type of medication is a little more controversial, which is medications for behavioral problems. So a lot of seniors are given medications for problems such as anxiety or depression, but also sometimes medications to try and control behavioral difficulties such as agitation or acting out in some ways. And those medications can be somewhat dangerous for the seniors in one level, and also they tend to be separately sedating, so also you're kind of almost making the person into a zombie sometimes. So they have to be considered very carefully and really monitored carefully by the doctors to make sure that the right dose is being given and it's really the appropriate medication for the person.
Exactly.
And unfortunately, there's no cure at the time, just those two types of medications.
Okay, thank you. Thank you. And perhaps we can go back to Denise quickly. As far as, you know, families do use medications with Alzheimer's disease, but what other things do you hear about that seem to work well to calm a loved one or to help them with cognitive stimulation, just to enhance their life? Do you have that kind of conversation on your site with family members?
Yeah, they do talk about how they spend the day, and I think sometimes the struggle can be, so we call the individual who's receiving care a caree, and sometimes they're uncooperative. So a program like an adult day center would be a wonderful option for many family members because the caree goes to a program during the day, receives socialization, stimulation, activities that are appropriate, but oftentimes there's that pushback from the caree, and so sometimes it's hard to understand, well, how do I work through this to get buy-in so that my caree goes? I think that sometimes family members worry about a stigma of being out in the community with an individual who has a cognitive impairment, and yet it is so much better today to be out in the community with your family member who has that cognitive impairment. I think we are so much more understanding. I know in my neighborhood I can see my neighbors walking with their carees. I live in Chicago, so it's not 12 months out of the year, unfortunately, but when it's warm out, we get out. We all run out when it's warm out. And I think it's really great when we can think about ways to simulate someone that has a cognitive impairment into our community, to provide activities, to ensure that they can continue to go to their house of worship and stay engaged in a spiritual way to what's important to them. And I think they're always looking for, how do I keep my caree engaged in the family and in the household? So sharing tasks like laundry or setting the table. Those tasks that can seem meaningless become meaningful. We really want to make sure that a caree feels like I'm contributing in my house, my family member's house, or the house I live in, which is a nursing home. So I think family members are really creative about what they do to ensure that their caree stays engaged and feels like they are participating in a meaningful way, that it's not just a way to spend time, but it's a way to make the time meaningful.
Yes, that's so very important. And the adult day that you mentioned, adult daycare, is also a really good solution for families. Often it's a fraction of the cost of other options, and they do receive that socialization, cognitive stimulation. So there are some really good social models for adult daycare out there as well.
Marilyn, could I mention one other thing? I'm so sorry.
Yes.
And that is to get your caree's life story as soon as you can. Even if you feel like, oh my gosh, I didn't get it, I'm not sure if I've waited too long, still try. Still ask those questions about what their childhood was like, if they remember the name of their first love, if it wasn't their spouse, what the cost of an ice cream cone was. All those questions that capture their life become part of the inheritance that you gain as a family caregiver. You have all these wonderful personal stories about your caree that you'll be able to pass on. And I would also mention that it's helpful to take video of your caree. So on caregiving.com, those who are caring for individuals, those individuals die. It happens all the time. We always think that we're going to live forever, right? But our family members die. And on a regular basis, those family caregivers will say that they wish they had videotape of their caree And you can think, oh my gosh, I don't want to take a videotape of my Carrie now. He's not who he was. But yet, if there's a moment that you enjoyed together and you've got your phone, your smartphone, just capture that moment because it's going to become very meaningful to you later on. One of my bloggers actually filmed her mom just 3 weeks before her mom died. And she had given her mom a purse. And it was the purse that her mom always had, but it was a new day, so it looked like a new purse. So she had her daughter actually tape the presentation of the purse. Here's a gift for you, Mom. And so her mom received the purse, opened it up, and then pulled out all the little treats, all the little gifts that this family caregiver put inside the purse. So her mom pulled out all the things that she had, but it was a new day, so they looked new to her. And she was just delighted at receiving all these little treasures. And after her Carrie died, the family caregiver was able to look back on this and think, oh my gosh, regardless of the disease process and what we went through, we did have really special, meaningful moments. And how wonderful to be able to capture those.
Yes. Yes, thank you. And that is very important. I think that, there's such a despair that sets in when that loved one no longer recognizes you or knows your name. But I do feel that they do know you on another level, and that connection and those moments of connection are really the best times. And in Santa Barbara, we have a woman by the name of Kate Carter, and she has a nonprofit called Life Chronicles, and she does travel throughout the nation documenting history and families, and what she's doing and offering is wonderful. So I wanted to go back to Luciana. Your role is so very important, and what the Alzheimer's Association is offering. I know that you offer respite grants for family caregivers and support groups and so many things. How can families and professionals best access all of the resources you provide locally and also nationally?
Well, the first thing is to make that first phone call, because we do not reach out to families. We wait until the families reach out for us. For HIPAA reasons, we may not reach out. So by calling the 800 number, which is 1-800-272-3900, a person will get connected to one of our care specialists. Then we would first make sure that they are receiving proper medical care. So if they have not been through a complete assessment, or they haven't been seen by a specialist, and we prefer that that specialist is a neurologist, so we will make the necessary referrals to that. And then we will make sure that this family has received plenty of information about what's to come with the disease. A lot of people see and think of dementia being a memory disease, and it is, but there's much more to that. People don't realize that there will be deficits in perception, in reasoning, in judgment, in organizations, and it ultimately will affect everyone's lives, not only the persons with dementia, but their loved ones. So we make sure that they have enough information about that, and not only on one-on-one consultations, but also workshops, and we have intensive workshops. If a person is going to be a long-term caregiver, we can give an intensive workshop and go through the entire spectrum of the disease, or we go over the year little by little, every stage of the disease, and continue that education. It's very important. And we see that the families who have made those first calls, they do follow up, they do come back for the workshops, and they end up using the resources that are available in the community, like in-home care services, like day centers. They use it more. Yes. We also provide support groups. And it's so important, like Denise was saying, that contact with other people going through the same thing. Their lives have changed. Their lives are now sometimes unmanageable, grueling. A caregiver may forget about their own needs. And sometimes I ask, you've taken your loved one to the doctor just last month. When was the last time you've been to a doctor? Sometimes they tell me years. So we have to remind them constantly that they are important too. Their care is important too. So in addition to that, we have a really good system on the website, alz.org, where they find the Caregiver Center. In the Caregiver Center, they can find a care team calendar where they can help the whole family become involved. We have training for caregivers, discussion boards, message board, and care planning tools that are really efficient in helping those families. But it is the personal contact with those families that I particularly really treasure. A family will stay with us for 3-4 years until their loved ones passed, and they really appreciate the support that they get.
That's wonderful. Thank you. Thank you so much for sharing that. You know, one of the things, if I could just ask another question of you, Dr. Landy, quickly, one of the things we didn't cover today, which is quite common, is wandering, the wandering behavior. And I'm just wondering if you have, you know, what interventions that you've seen that have worked for families, and why does that happen? Why do people wander when they have Alzheimer's disease?
Actually, one of the most basic things that seems to be most effective and that people tend to overlook is exercise. If you think about it, if all of us sit in an office all day and don't ever move, we get pretty bored. But sometimes for families, they kind of keep the person at home in their one room doing nothing. And actually getting them out and actually doing things can be one of the best treatments. Really, with wandering, the key point here is trying to determine what is the actual cause. Some person might be wandering because they're confused, they don't know what's happening, or maybe they're looking for something like food or the restroom. Really trying to see if there's something that can help determine that the person wants, maybe some lack of comfort. But really, I tend to see trying to help people get exercise and getting enough rest at night seems to be some of the most effective things.
That's wonderful. So they do. They have the need to move around. And they stay healthier longer that way as well.
Definitely.
Yeah, definitely. Thank you. Stan, if we could touch on what you're offering a little bit once more. Our call is going to be wrapping up in a little bit here. But back to long-term care insurance, could you share a success story with us that in regards to a family that had long-term care and had a high cost of care?
I have a client out here in the Canal Valley. Her husband had a series of strokes. And when I went the first time I saw the lady, the woman, he was a very successful movie producer. And they had all kinds of resources that were at their disposal because they could afford it. But the woman said to me, when I asked her why she was interested in this type of coverage, she said, I want to leave it for my children. But she also said to me, when we got married, it was for, better or health, better or poorer, for richer or poorer, and I promised that I would take care of him. And the wear and tear on this woman was unbelievable. I saw her about 6 weeks after I saw her the first time, and this woman looked like she aged probably around 3 years in just a short period of time because she was the primary caregiver. When I saw her again after her husband had died about 2 or 3 years later, the aging process looked like it had reversed. There was a release, like the cloud had been released from her head. And what I feel long-term care does is it takes that responsibility and shifts it so that you can love the person and be there for them when they need care, but not be the caregiver.
Yes. Thank you. I just got a question in here from Suzette Brown. And her question is, I had so many people tell me my mother was fine. I, of course, was the only one who knew she was not fine. It was very frustrating. What do caregivers say to these individuals? In other words, how does she be an advocate for herself and her mother? Maybe this is a good one for either Luciana or Denise. In expressing to people that she's not fine in that situation, that it's very difficult.
I hear that a lot, Marilyn. Normally, the ones who are closest with the person with dementia are the ones who are actually seeing the little lapses in judgment, the little lapses in reasoning. And a person with dementia may present themselves very well socially and do a small talk wonderfully, vibrantly, enthusiastically, while in their own personal lives they are defaulting in, let's say, hygiene, eating properly, drinking enough fluids, and only the ones who are closest see that. And
Yeah.
sometimes it's a battle to educate the family at large about what's happening. And we can help with that, with providing educational materials that they can share amongst each other and talk to us directly. That is very important. Caring shouldn't be a battle with the rest of the family. The family should be united in providing care to that person.
Yes, thank you. I agree. Denise, did you want to add something?
I just wanted to add a tip. And hi, Suzette. I'm glad you were able to join us today. I think it's really important to actually create something like a diary that you use to jot down what you see in terms of your caree's behavior, medical condition, how often you provide medications, care. The diary can really be helpful to you to stay grounded to the reality of the situation. So during, for instance, a Memorial Day get-together that happened yesterday, perhaps your Carrie was having a great day, and everybody's saying, wow, she's having a great day, she looks great, and you're thinking, oh my gosh, did I just imagine everything? If you have a journal that really talks about the scope of all the challenges that you face, it can help you stay grounded to what the reality is. And I do think in those moments when everybody says to you, this must be a piece of cake because she looks great to us, I think you can say in that moment, she is having a great moment right now. I am so grateful that we are having a good moment, so I'm going to enjoy it. Because you never know what tomorrow will bring. You don't have to necessarily, you can get caught up into always explaining and defending. And I think you can stay focused in on the moment that this is a good moment. Enjoy it. Express that. And you can just add, and we never know what tomorrow will bring.
Yes.
And also, remember that if she's having a great day, it's mostly because of all the efforts that you have put into providing her enough support to having a great day. So acknowledging that your efforts were successful, it can also help, giving you a little lift to continue doing this very grueling work for years to come.
That's a great suggestion, and you can say it in such a way that sounds very gracious, but you can also toot your own horn. You can say, you know what, gosh, the morning that we had, I can't believe she's doing this great because we went through, and you can give them a little insight into what you went through in the morning, and I'm so glad we got here and we're doing great because we're both here to have some fun.
That's wonderful. Great advice. Thank you so much. Suzette, I hope that was helpful to you, and thank you for joining us. It is time to wrap up our call. I wanted to again thank all of the panelists for participating in our home care hangout today. LivHOME will be doing another home care hangout next month. Hopefully anyone who is watching us now will also join us next month. So thank you so much again, and have a wonderful week for all the caregivers and families out there, and all the professionals who are helping them. Thank you so much. Bye-bye.
Thank you, Marilyn.
Thank you.